Hi guys, I'm Aljustin B. Abdul from BSN third year Ophiuchus, and for today we are going to tackle about this gastrointestinal system. Only brief discussion. So what is the gastrointestinal system? It is a tract from mouth to anus, which include all organs of the digestive system in humans and other animals. So food taken in through the mouth is digested to extract nutrients and absorb energy, and waste is expelled as feces. So gastrointestinal tract is the organ that take in food and liquid and break down into substances that the body can use for energy, growth, and tissue repair. So waste product that the body cannot use leave body through bowel movements. Then we have the principal functions of gastrointestinal tract are to digest and absorb ingested nutrients and excrete waste product of digestions. So most nutrients are ingested in a form that is either too complex for absorption or insoluble and therefore indigestible or incapable of being digested. So gastrointestinal is responsible for, there are three main functions of gastrointestinal tract. So we have the, including the transportation, digestion, and absorption of food. So the mucosal integrity of the gastrointestinal tract and the functioning of its accessory organs are vital in maintaining the health of your patient. So what is the digestion? Why is the digestion important? So digestion is important for breaking down foods into nutrients, which is the body uses for energy, growth, and cell repair. Food and drinks must be changed into smaller molecules of nutrients before the blood absorbs them and carries them to the cells throughout the body. We have general symptoms of gastrointestinal conditions. So abdominal discomfort, bloating, pain or cramps, unintentional weight loss, vomiting and nausea, acid reflux or heartburn, diarrhea or constipation, or sometimes both, fecal incontinence, fatigue, and also loss of appetite. Here are some diseases that included in gastrointestinal system. So we have here inflammatory bowel disease, Crohn's and ulcerative colitis, appendicitis, and periodontitis. That is explained by my group mates. So moving on to the urinary system. What is urinary system? It is also known as renal system or urinary tract. Consists of kidney, ureter, bladder, and urethra. So the purpose of urinary system is to eliminate waste from body, regulate body blood volume and blood pressure, control level of electrolytes and metabolites, and regulate blood pH. So the urinary system consists of the kidney, ureter, urinary bladder, and the urethra. So this urinary system is the organ that make urine and remove it from the body. The urinary system is divided into two parts. The upper urinary system include the kidney and the ureter. The lower urinary system include the bladder and the urethra. So the function of this urinary system is to filter blood and create urine as waste byproduct. The organs of the urinary system include the kidney, the renal pelvis, ureters, bladder, and urethra. The body takes nutrients from the food and convert it to the energy. And we have also the major functions is to remove waste product and medicine from the body, balance the body fluids, balance a variety of electrolytes, release hormones to control blood pressure, release hormones to control red blood cell productions, help with bone and health by controlling calcium and the phosphorus. There are some diseases that included in urinary system. We have the cystitis and the urolithiasis, which is the stones in the kidney. That is explained by my group mates.
Assalamualaikum warahmatullahi ta'ala wabarakatuh, and good morning, ma'am. So today, I'm going to report about the inflammatory bowel disease, which is include the ulcerative colitis and Crohn's disease. So when we say inflammatory bowel disease or IBD, involves chronic inflammations of all parts of your digestive tract. IBD primarily includes ulcerative colitis and Crohn's disease. Both usually involve severe diarrhea, pain, fatigue, and weight loss. IBD can be debilitating and sometimes lead to life-threatening complications. Ulcerative colitis is an inflammatory bowel disease that causes long-lasting inflammations and sores or ulcers in the innermost lining of your large intestine, colon, and rectum. And also, when we say Crohn's disease, is an IBD that causes inflammations of the lining of your digestive tract. In Crohn's disease, inflammations often spread deep into affected tissue. The inflammations can involve different areas of digestive tract, the large intestine, small intestines, or both. So, and lymphatic colitis also are considered inflammatory bowel disease but are usually regarded separately from classic inflammatory bowel disease. So, these are the symptoms for both disease. So, inflammatory bowel disease symptoms vary depending on the severity of the inflammations and where it occurs. Symptoms may range from mild to severe. You are likely to have periods of active illness followed by periods of remissions. And the next one is, these are the signs and symptoms that are common to both Crohn's disease and ulcerative colitis include. We have the diarrhea. So diarrhea is a common problem for people with IBD. Then also fever and fatigue. Many people with IBD experience a low-grade fever. You may also feel tired or have low energy. And also we have abdominal pain and cramping. Inflammations and ulcerations can affect the normal movements of content through your digestive tract and may lead to pain and cramping. You may also experience red blood in the toilet bowl or darker blood mixed with your stool. You can also have bleeding you don't see in a cold blood. So next is we have a reduced appetite. So in reduced appetite, abdominal pain and cramping as well as inflammations can affect your appetite. So these are, and also we have unintended weight loss. So when you have unintended weight loss, meaning you may lose weight and even become malnourished because you cannot properly digest and absorb food. So we have here the types of the inflammatory bowel disease or IBD. So we have ulcerative colitis is classified according to the locations of inflammations and severity of symptoms. And also we have ulcerative proctitis. So meaning in ulcerative proctitis, inflammation is confined to the area closest to the anus, rectum, and rectal bleeding may be the only signs of the disease. These forms of ulcerative colitis tend to be the mildest. So, next is we have a proctosigmoiditis. So, meaning in this disease, inflammations involve the rectum and sigmoid colon, lower end of the colon. Signs and symptoms include bloody diarrhea, abdominal cramps and pain, and an inability to move the bowel in spite of the urge to do so in tenesmus. So next is we have a left-sided colitis. So in left-sided colitis, inflammations extends from the rectum up through the sigmoid and descending colon. So signs and symptoms of this left-sided colitis include bloody diarrhea, abdominal cramping, and pain on the left side, and unintended weight loss. So in the next one is we have a pondylitis. So in pondylitis often affect the entire colon and causes both of bloody diarrhea that may be severe, abdominal cramp and pain, fatigue, and significant weight loss. So that are the disease. And also we have acute severe ulcerative colitis. So when we say acute, meaning this previous called fulminant colitis. This area or rare forms of colitis affect the entire colon and causes severe pain, profuse diarrhea, bleeding, fever, and inability to eat. So next is we have The number 2 disease for IBD, this we call Crohn's disease. So Crohn's disease may involve inflammations in different parts of the digestive tract in different people. The most common areas affected are the last part of the small intestine, in the ileum part and the colon. And the next is, we have inflammations may be confined to the bowel wall, which can lead to narrowing from inflammations or scarring or both fibrostenosis, or may tunnel through the bowel wall or in the fistula. Narrowing may lead to the blockage or obstructions, we can say. Obstruction, stenosis, and fistulas are not associated with ulcerative colitis. So, these are the reasons, or you have to go or tell the doctors when to see a doctor. So, see your doctors if you experience a persistent change in your bowel habits, or if you have any of the signs and symptoms of inflammatory bowel disease or IBD. So although inflammatory bowel disease usually isn't fatal, it's a serious disease that in some cases may cause life-threatening complications. So these are the cause for the IBD disease. So the exact cause of inflammatory bowel disease remain unknown. Previously, diet and stress were suspected, but now doctors know that these factors may aggravate but don't cause IBD. So the one possible cause in an immune system malfunctions. When your immune system tries to fight off an invading virus or bacterium, an abnormal immune system may cause the immune system to attack the cells in the digestive tract. 2. And heredity also seems to play a role in the IBD. It's more common in people who have family members with the disease. However, most people with IBD don't have this family history. So these are the example for risk factor for that IBD disease. So we have age. So like for example, persons in age, most people who develop IBD are diagnosed by before they reach 30 years old. But some people don't develop the disease until their 50s or 60s. So next is we have race or ethnicity. So although white have highest risk of the disease, it can occur in any race. If you're of the disease, your risk is even higher. So next is we have a family history. So these are the risk factor. So in family history, you are at higher risk if you have a close relatives, such as parents, siblings, or child with the disease. So next is we have a cigarette smoking. So these are also the disease or risk factor for that IBD. Cigarette smoking is the most important controllable risk factor for developing Crohn's disease. However, smoking may provide some protections against ulcerative colitis. The overall health benefits of not smoking, some these make it important to try to quiet. So next is we have isotretinoin use. Isotretinoin or amnestin clavitis formeri or Accutane is a medication sometimes used to treat scary, cystic acne or acne. Some studies suggest it may be risk factor for IBD, but a clear association between IBD and isotretinoin has not been established. So next is we have a non-steroidal anti-inflammatory medications. So these include ibuprofen, Advil, Motrin IV, or others. Naproxen sodium or alevtic anaprin diclofenac sodium. The risk of developing IBD or worsens disease in people who have IBD. So when you live, so like for example, the risk of developing those IBD, if you live in an urban area or in an industrialized country, you're more likely to develop IBD. Therefore, it may be that environmental factors including a diet high in fat or refined foods play a role. People living in a northern climates also seem to be at greater risk. So in the next one is we have a complications for those IBD disease. So Crohn's disease may lead to one or more of the following complications. So we have inflammation. Inflammations may be confined to the bowel wall, which can lead to diarrhea and bleeding. Inflammations can also lead to scarring and narrowing, or we can call as stenosis, or may spread through the bowel wall or fistula. And also we have bowel obstructions. So when we say bowel obstructions, this is also the complications for Crohn's disease, affects the full thickness of the intestinal wall. Over time, part of the bowel can thicken and narrow, which may block the flow of digestive content. You may require surgery to remove the diseased portions of your bowel. So next complication is we have ulcer. So this is also chronic inflammations can lead to open sores, or we can call ulcer, anywhere in your digestive tract, including your mouth and anus, and in the genital area or in the perineum. So the next one is we have a fistulas. So this fistulas also the complications for IBD. Sometimes ulcer can extend completely through the intestinal wall, creating a fistula, an abnormal connections between different body parts. So fistula can develop between your intestine and skin, or between your intestine and other organ. Fistula near or around the anal area, or we can call the perianal, are the most common kind. When fistula develop in the abdomen, so food may bypass areas of the bowel that are necessary for absorptions. Fistula may occur between loops of the bowel into the bladder or vagina, or out through the skin, and also causing the continuous drainage of bowel contents to your skin. So in some cases, a fistula may become infected and forms an abscess, which can be life-threatening if not treated. So in the next one is we have anal fissure. This is a small tear in the tissue that lines the anus or in the skin around the anus, where infected can occur. It's often associated with painful bowel movement and may lead to a perineal fistula. So next complication is we have a malnutrition. So malnutrition include the diarrhea, abdominal pain, and cramping may make it difficult for you to eat, or for your intestine to absorb enough nutrients to keep you nourished. It's also common to develop anemia due to low iron or vitamin or B12 caused by the disease. So next complication is we have a colon cancer. So colon cancer having Crohn's disease that affects your colon increase your risk of colon cancer. General colon cancer screening guidelines beginning, or for people without Crohn's disease, call for a colonoscopy every 10 years beginning at age 50. However, depending on how long you have had Crohn's disease and how much of your colon is involved, you may need a colonoscopy as often as very 1 to 2 years. So ask your doctor how often you should have a colonoscopy. Other health problems, Crohn's disease can cause problems in other parts of the body, such as inflammations of eyes, skin or joint, anemia, osteoporosis, inflammations of the liver or bile duct, and delayed growth or sexual development in child. So next complication is we have a medication. So in medications, certain medications for Crohn's disease act by blocking functions of the immune system, are associated with a small risk of developing cancer such as lymphoma and skin cancer. They also increase risk of infections. So next is we have a corticosteroids. So this corticosteroid can be associated with a risk of osteoporosis, bone fracture, cataracts, glaucoma, diabetes, and high blood pressure. Work with your doctor to determine risks and benefits of medications. So these are the possible complications of ulcerative colitis include. So we have a severe bleeding, a hole in the colon, perforated colon, or severe dehydrations, liver disease or rare, bone loss, osteoporosis, inflammations of your skin, joint, and eyes, sores in the lining of your mouth, and an increase of colon cancer, and a rapid swelling colon, toxic or megalon, colon, and also increased risk of blood clots in veins and arteries. That's all my reports about the IBD or the disease included in the IBD.
Good morning, I'm Selena Ahmad. My topic for today is cystitis. Cystitis is the medical term for inflammations of the bladder. Most of the time, inflammation is caused by a bacterial infection. It is called a urinary tract infection, UTI. A bladder infection can be painful and annoying, and it can be a serious health problem, and if infection spread to your kidney. Cystitis, signs and symptoms often include a strong, persistent urge to urinate, a burning sensation with urinating, passing frequent small amount of urine, blood, and the urine hematuria, passing include cloudly to or strong smelling urine, pelvic discomfort, and feeling of pressure in the lower abdomen, low-grade fever. Seek immediate medical help if you have signs and symptoms common to a kidney infection include back pain or side pain, fever and chill, nausea, and vomiting. Caused by the female urinary system, open pop up dialog box, male urinary system, open pop up dialog box. Your urinary system include your kidneys, ureters, bladder, and urethra. All play a role in removing waste from your body. Your kidneys, upper of the vein-shaped organs located toward the back of your upper abdomen, filter waste from your blood and regulate the concentrations of many substances. Tube, called the ureters, carry urine from your kidneys to the bladder, where it's stored until it exits your body through the urethra. Bacterial cystitis. UTI typically occur when the bacteria outside the body enter the urinary tract through the urethra and begin to multiply. Most causes of the cystitis are caused by type E. coli bacteria. Non-infectious cystitis. Although bacterial infections are the most common cause by the cystitis, a number of non-infectious factors also may cause the bladder to become inflamed. Some examples include interstitial cystitis. The cause of this chronic blood inflammation, also called painful bladder syndrome, is unclear. Most causes are the diagnosis in women. The condition can be difficult to diagnose and treat. Drug-induced cystitis, certain medication, particularly by the chemotherapy drugs, cyclophosphamide and ifosfamide, can cause inflammations of your bladder as the broken down component of the drug exits your body. Radiation cystitis. Radiation cystitis, treatment of the pelvic area, can cause inflammation change in the blood and bladder tissue. Foreign body cystitis. Long-term use of a catheter can predispose to bacterial infection and to tissue damage, both of which can cause inflammation. Chemical cystitis. Some people may be hypersensitive to chemicals contained in certain products, such as bubbles bath, feminine hygiene spray, or spermicidal jellies, and may develop an allergic type reaction within the bladder cause inflammation. Risk factor. Some people are more likely than others to develop bladder infection or recurrent urinary tract infection. Women are one such group. A key reason is physical anatomy. Women have a shorter urethra, which cuts down on the distance bacteria must travel to reach the bladder. Complications. When treated promptly and properly, bladder infection rarely lead to complications, but left untreated, they can become something more serious. Complications may include kidney infection. Untreated bladder infection can lead to kidney infection, also called pyelonephritis. Kidney infection may permanently damage your kidneys. Young child and older adults are at the greatest risk of kidney damage from the bladder infection because their symptoms are often overlooked or mistaken for other conditions. Blood and the urine. With cystitis, you may have blood cells in your urine that can be seen only with microscope. Microscopic hematuria, and that usually resolve with treatment. If blood cells remain after treatment, your doctor may recommend a specialist to determine the cause. Blood and the urine that you can see cross hematuria is rare with typically bacterial cystitis, but these signs are more common with chemotherapy or radiation-induced cystitis. Prevention. Cranberry juice or tablets containing proanthocyanidin are often recommended to help reduce the risk of recurrent bladder infection for some women, but research in this area is conflicting. Some smaller studies demonstrate a slight benefits, but larger studies found no significant benefits. As a home remedy, avoid cranberry juice if you are taking the blood-thinning medication warfarin. Possible infection between cranberry juice and warfarin can lead to bleeding. Although these preventive self-care measures aren't well studied, doctors sometimes recommended the following for repeated bladder infection. Drink plenty of liquid, especially water. Drinking lots of fluids is especially important if you are getting chemotherapy or radiation therapy, particularly on treatment days. Urinate frequently. If you feel the urge to urinate, don't delay using the toilet. Wipe from front to back after a bowel movement. This prevents bacteria and the anal regions from spreading to the vagina and urethra. Take showers rather than the tubs, but if you are susceptible to infection, showering rather than bathing may help prevent them. Gently wash the skin around the vagina and anus. Do this daily, but then use harsh soap or wash to. But don't use harsh soap or wash too rigorously. The delicate skin around these areas can become irritated. Empty your bladder as soon as possible after intercourse. Drink a full glass of water to help flush bacteria. Avoid using deodorant spray or feminine products and genital area. These products can irritate the urethra and bladder.
Assalamualaikum, I am Trisha Harandi Akip and I'm going to report peritonitis. Peritonitis is a redness and swelling inflammation of the tissue that lines your belly or abdomen. This tissue is called the peritoneum. It can be a serious deadly disease. What is the common cause of peritonitis? Peritonitis is usually caused by infection from bacteria or fungi. Left untreated, peritonitis can rapidly spread into the blood, sepsis, and to other organs, resulting in multiple organ failure and death. What are the signs and symptoms of peritonitis? First is abdominal pain or tenderness. Second, fever. Third is nausea and vomiting. Fourth is loss of appetite. Fifth, diarrhea. Sixth is thirst. Seventh, low urine output. And the last one is bloating or a feeling of fullness in your abdomen. The treatment for peritonitis is usually involves antibiotics and in some cases, surgery. Left untreated, peritonitis can lead to severe, potentially life-threatening infection throughout your body. A common cause of peritonitis is peritoneal dialysis therapy. My next topic is appendicitis. Appendicitis is an inflammation of the appendix, a finger-shaped pouch that projects from your colon on the lower right side of your abdomen. Appendicitis causes pain in your lower right abdomen. However, in most people, pain begins around the navel and then moves. What are the symptoms of appendicitis? First is pain in your lower right belly or pain near your navel that moves lower. This is usually the first sign. Second is loss of appetite. Third is swollen belly. Fourth is can pass gas. And the last one is nausea and vomiting soon after belly pain. What are the treatment for the appendicitis? Appendicitis is almost always treated as an emergency. Surgery to remove the appendix, which is called an appendectomy, is the standard treatment for almost all cases of appendicitis. Generally, if your doctor suspects that you have appendicitis, they will quickly remove it to avoid a rupture.
Hi, I am Erwina Alam. Now I'm going to discuss about the pancreatitis and cholecystitis. So, first is pancreatitis. Pancreatitis is an inflammation of our pancreas. So, our pancreas sits behind our stomach, near our small intestine. And also, it releases enzymes that help us digest food and also regulates how our body manages glucose. So pancreatitis can come and go quickly, or it can be a chronic or acute problem. Treatment of this disease is depend on whether your pancreatitis is acute or chronic. We have two types of pancreatitis: the acute and chronic pancreatitis. So when we say acute pancreatitis, it is a main cause of hospital admissions for gastrointestinal issues. And also acute pancreatitis is much more common in adults than children. Gallstones are the primary cause of the acute pancreatitis for adults. The conditions can also develop into chronic pancreatitis, especially if a person smoke or drink alcohol heavily. So, chronic pancreatitis is an inflammation of the pancreas that comes back constantly or occur over a long period of time. People with chronic pancreatitis can have permanent damage to their pancreas and other complications. Scar tissues develop from this continued inflammation. So pancreatitis can damage cells that produce insulin. When we say insulin, it is a hormone that pancreas releases to regulate the amount of sugar in our blood. So symptoms for the pancreatitis is most people who have acute or chronic pancreatitis usually experience with the left upper abdominal pain as their primary symptoms. But also we have a specific symptoms for this pancreatitis. So for acute pancreatitis symptoms are pain that starts slowly or suddenly in our upper abdomen, pain that may spread to the back, mild or severe pain that may last for several days, fever, nausea, vomiting, swelling, or tender abdomen and fast heart rate. So for the chronic pancreatitis symptoms, have pain in the upper abdomen or no pain at all. Then diarrhea, nausea, vomiting, weight loss. Then people who have chronic pancreatitis may also experience sterothea, which is fatty stool of a full odor. So when we say steatorrhea, can be a sign of malabsorption. This means you're not getting all of your essential nutrients because your pancreas does not secrete enough digestive enzyme to break the foods. So pancreatitis causes. So acute and chronic pancreatitis share many of the same causes. This includes gallstones, drinking a lot of alcohol, and some medication, abdominal surgery infections, cystic fibrosis injury to our belly, and high level of calcium in the blood can also lead to chronic pancreatitis. So, gallstones are the most common cause of the acute pancreatitis. Gallstones are small, solid masses that form from bile, fluids that helps with digestion. So, gallstones are the most common cause of acute pancreatitis. Gallstones are small, solid masses that form from bile, fluids that help with digestion. So, pancreatitis risk factors. So, several factors to increase the pancreatitis. These include heavy alcohol use, more than 2 drinks per day, obesity, smoking cigarettes. So, a combination of the risk factors like smoking and having a family history of pancreatitis increase or changes of getting pancreatitis. So, pancreatitis complication. Some people may develop complications from pancreatitis. These complications are rare, but they're more common in people with chronic pancreatitis. So, pancreatic cancer, malnutrition, diabetes, pancreatic infections. It can cause pseudocytes to form when tissue and other debris collect on our pancreas. So, the diagnosis for pancreatitis, your doctor will likely use a combination of blood tests and imaging studies to make a diagnosis. If you have acute pancreatitis, you will have severe abdominal pain. Blood tests may show a significant rise in your level of pancreatic enzymes. Different types of ultrasound, MRI, and CT scan can reveal the anatomy of our pancreas. Signs of inflammations and information about the biliary and pancreatic ducts. So, that treatment for pancreatitis, for acute or chronic pancreatitis often involves hospitalization. The pancreas is a key contributor to our digestive process and needs to rest to heal. So, for this reason, you may receive specially tailored fluid and nutrition intravenous or IV through a tube that goes from your nose directly into your stomach. This is called a nasogastric feeding tube. So, medication may help manage the pain. You may also receive artificial digestive enzyme for chronic pancreatitis if your pancreas is not producing enough of them on its own. So, pancreatitis prevention. Depending on the cause, you may not be able to prevent pancreatitis. Still, there are several things you can do to reduce your risk. So like limiting alcohol use, stop smoking, maintain a moderate weight, eat a balanced diet. Eating high fiber foods can avoiding sugar, and also it may help you prevent gallstone, which are the main cause of acute pancreatitis. So that's all for the pancreatitis. So now let's proceed to cholecystitis. Cholecystitis is an inflammation of the gallbladder. Our gallbladder is a small, pear-shaped organ on the right side of our abdomen, beneath our liver. So the gallbladder holds digestive fluids that release into our small intestine or bile. So, in most cases, gallstones blocking the tube leading out of our gallbladder, which is called cholecystitis. Then, this results in a bile buildup that can cause inflammations. Other causes of cholecystitis include bile duct problem and tumors. If left untreated, cholecystitis can lead to serious, sometimes life-threatening complications, such as a gallbladder rupture. Treatment for cholecystitis often involve a gallbladder removal. So, symptoms for the cholecystitis. Signs and symptoms of cholecystitis may include severe pain in our upper right abdomen, pain that radiates from the right shoulder or back, tenderness over our abdomen when it's touched, nausea, vomiting, and fever. Cholecystitis signs and symptoms often occur after meal, particularly a large or fatty meal. When to see a doctor? Make an appointment with your doctor if you have worrisome signs or symptoms for the cholecystitis. For abdominal pain, so severe you can sit still or get comfortable, have someone drive you to the emergency room. The causes for the cholecystitis. Cholecystitis occur when your gallbladder becomes inflamed. Gallbladder inflammation can be caused by most cholecystitis is the result of hard particles that develop in our gallbladder from imbalances in a substance in bile, and also such as cholesterol and bile salts. Gallstone can block the cyst duct, the tube through which bile flows when it leaves the gallbladder, causing bile to build up and resulting in inflammation. Tumor. A tumor may prevent bile from draining out of our gallbladder properly, causing bile buildup that can lead to cholecystitis. Bile duct blockage, kinking or scarring of the bile duct can cause blockage that lead to cholecystitis. The risk factors of this cholecystitis, having gallbladder is the main risk factor for developing cholecystitis. So, complications for the cholecystitis can lead to a number of serious complications, includes infections within the gallbladder. If bile builds up with our gallbladder, causing cholecystitis, the bile may be infected. So, death of gallbladder tissue. Untreated cholecystitis can cause tissue in the gallbladder, can lead to a tear in the gallbladder, or it may cause our gallbladder to burn. Turn gallbladder. A tears in your gallbladder may result from gallbladder enlargement or infections. So that's all for my report regarding pancreatitis and cholecystitis.
Morning, ma'am. Now I'm going to tackle orolithiasis and nephrolithiasis. Orolithiasis and nephrolithiasis refers to stone calculi in the urinary tract in kidney respectively, and urinary stone predominantly or karamihan occur in the 3rd to 5th decades of life, in effect men twice as often as women. And stones develop in one or both kidneys in early episodes are increasing. Physiology: stones are formed in the urinary tract when urinary concentrations of substances such as calcium oxalate, calcium phosphate, and uric acid increase. And referred to as supersaturation, this depends on the amount of the substances, ionic strength, and pH of the urine. Stones may be found anywhere from the kidney to the bladder and may vary in size from minute granular deposits called sand or gravel to bladder. Stone as large as orange. Management: sign and symptoms: severe flank pain, abdominal pain, nausea and vomiting, fatigue, elevated temperature, BP and respiration, steady pain, and pain on urination and obstruction, renal colic and hydronephrosis, and hematuria. Assessment and diagnostic findings: non-contrast CT scan, blood chemistries, 24 hours urine test for measurement of calcium, uric acid, creatinine, sodium, pH, and total volume. Chemical analysis and stone analysis, which are opioid analgesic agents, non-steroidal anti-syncope, hot bath in moist heat, and fluid restriction. Nutritional therapy: the patient with kidney stones should drink 8 to 10 glasses of water daily, have IV fluids prescribed, calcium stone, restrict calcium diet, liberal fluid intake, ammonium chloride, and thiazide diuretics, and low purine diet, allopurinol, celloprene. For the preventing kidney stones, avoid protein intake to decrease urinary excretion of calcium and uric acid, and limit sodium intake 2 to 4 grams per day, and avoid intake of oxalate containing food, and drink fluids like water or cranberry juice, and avoid activities leading to sudden increase in environmental temperature that may cause excessive sweating and dehydration. And contact the primary provider at the first sign of a urinary tract infection. Stone, which are low protein diet, increased fluid intake, and oxalate stones, limited intake of oxalate, maintain the dilute urine, and alkaline urine. Procedure, which are endoscopic, ureteroscopy, extracorporeal shock wave lithotripsy, and enterologic lithotripsy, and chemolysis. Medical management, the surgery performed may be a nephrolithotomy, removal of stone by surgical incision, and nephrolithotomy if the kidney is non-functional. Stone in the kidney pelvis are removed by a pilototomy, and if the stone ureter, chemolysis.